The BCG vaccine has been used for nearly a century to protect against tuberculosis. TB is caused by bacteria which affects the respiratory system. The vaccine has been instrumental in fighting respiratory infections in children, especially in middle and low-income countries. In South Africa, the vaccine has reduced respiratory infections by 73%. These successes have led to the suggestion that the vaccine might have a role in protecting the immune system against COVID-19.
The way it's spreading and the way it's impacting populations has differed. And so when we analyzed the data, and particularly this group, they were able to show that those countries that have had BCG immunization programs appear to have less COVID-19 than those that don't. So with that one observation, we also know that certain live viruses, so BCG is an example of that, others are polio and measles, they kind of trigger some kind of immune response. We call it an innate immune response, and that this innate immune response actually protects you from other similar infections.
However, there is not much information to determine if the vaccine could cause side effects. Experts say the live bacterium could cause complications in people with immunodeficiencies.
And I would imagine when we start doing therapeutic trials or even vaccine trials, one of the things that we may be looking at is what type of vaccine are we developing in terms of, is it a therapeutic vaccine or is it a preventive vaccine, and how best and who best would benefit from it. So right now the evidence points towards older people.
Scientists across the globe are also working on developing several drugs for treatment of those infected with the virus.
Level studies are talking about evidence of immunization from several decades ago. And so, I mean, the idea of pursuing BCG vaccines now, will it protect or not? We don't know. That's why these trials are underway. But this is the underlying scientific rationale. It'll be interesting to see as, one, the epidemic progresses, whether there's protective benefits. But two, if you give it at this point to individuals who are infected or at risk of getting infected, will it offer protection is one we need to pursue.
Experts also warn against diverting the vaccine for use against COVID-19 away from its intended purpose to fight TB. In the absence of proof that it can help fight COVID-19, the World Health Organization had recommended against its use. For now, the world can only await and hope for a positive outcome on the international trials. Jade Lee Paulser, SABC News, Durban.